Hey there, folks. Today, we're diving into how your liver processes medications. Think of your liver as a chemical processing plant. It works tirelessly to filter out toxins and break down substances we consume. But just like any plant, it can get overwhelmed. When we take medications, our liver has to work extra hard to process these chemicals. If it gets overloaded, it can lead to liver damage. So let's explore how this vital organ manages its workload and what happens when it can't keep up. Starting off, we are covering drug-induced liver injury, or also known as DILI. DILI is basically what it sounds like: damage to your liver caused by medications. It's like your liver is allergic to the very thing that's supposed to help you. DILI can be caused by all sorts of medications, from over-the-counter painkillers to prescription antibiotics. And it can happen to anyone, regardless of age, gender, or health. It's like playing Russian roulette with your liver. DILI comes in two main types: intrinsic and idiosyncratic. Intrinsic DILI is predictable, related to the dose you take. Idiosyncratic DILI is unpredictable and can happen even at normal doses. Let's break down intrinsic DILI first. As we just learned, it's all about dosage. Think of it like this. If you drink 1 cup of coffee, you'll get a nice caffeine boost. But if you chug down 10 cups in a row, you'll be bouncing off the walls with a nasty case of the jitters. It's the same with certain medications. Take too much, and your liver gets overwhelmed trying to break it all down. A classic example is acetaminophen, the active ingredient in Tylenol and a bunch of other painkillers. Acetaminophen is generally safe when taken as directed, but exceeding the recommended dose, even just a little bit, can seriously damage your liver. It's like throwing a wrench into your liver's delicate machinery. So, the lesson here is simple. Always, always, always follow the recommended dosage on the label. And if you're ever unsure, ask your doctor or pharmacist. They're there to help you, not judge you for not understanding medical jargon. Now, let's move on to the more mysterious and frustrating type of DILI, the idiosyncratic kind. This one is tricky because it's not about dosage. It's like your liver randomly decides it's allergic to a particular drug, even if you've taken it before without any problems. It's like playing the lottery, but instead of winning millions of dollars, you win a one-way ticket to liver damage land. And trust me, the odds are not in your favor. So what causes this random act of liver rebellion? Well, it's complicated. Scientists believe it's a combination of factors, including your genes, your age, your overall health, and even other medications you might be taking. It's like a perfect storm of unfortunate circumstances that can trigger this type of liver damage. The frustrating part is that there's no way to predict who will be affected by idiosyncratic DILI. It can happen to anyone, at any time. But we'll talk about ways to minimize your risk a bit later. Section 5. Red flag medications, from painkillers to antibiotics. Now, for the million-dollar question, which medications are most likely to cause DILI? Well, it's a long and ever-changing list. But here are a few usual suspects to watch out for. Painkillers. We've already talked about acetaminophen, but other painkillers like ibuprofen and naproxen can also cause liver damage, especially at high doses or when taken for long periods. Antibiotics. While crucial for fighting infections, certain antibiotics like amoxicillin clavulanate, also known as augmentin, and flucloxacillin can sometimes trigger DILI. Cholesterol-lowering drugs. Statins, commonly prescribed to lower cholesterol, are generally safe, but in rare cases they can cause liver inflammation and damage. Anti-seizure medications, drugs like phenytoin and valproic acid, used to treat epilepsy, can also potentially harm the liver. Remember, this is not an exhaustive list, and just because a drug is on this list doesn't mean it will definitely cause liver damage. It just means it's important to be aware of the potential risks and to talk to your doctor if you have any concerns. Is your liver sending you an SOS? Recognizing the signs of DILI is crucial. It often doesn't cause symptoms early on. When symptoms do appear, they can be vague. Watch out for these red flags: jaundice, yellowing of the skin and eyes, fatigue, constant tiredness, loss of appetite, nausea and vomiting, dark urine and pale stools. If you notice these, call your doctor. Early detection is crucial. Section 7. Diagnosis and treatment. Putting the liver damage puzzle together. Diagnosing DILI can be tricky because there's no single test that can definitively diagnose it. It's like trying to solve a puzzle with missing pieces. Doctors use a combination of methods to make a diagnosis, including medical history. They'll ask about your medications, any pre-existing conditions, and your alcohol intake. Physical exam. They'll check for signs of liver damage, like jaundice and abdominal swelling. Blood tests. Liver function tests can measure the levels of certain enzymes and proteins in your blood, which can indicate liver damage. Imaging tests. Ultrasound, kinetic scans, or MRI scans can help visualize the liver and look for any abnormalities. Treatment for DILI typically involves stopping the medication that's causing the problem. In some cases, medications may be given to help manage symptoms and support liver function. The good news is that the liver is an amazing organ with an incredible ability to heal itself. With prompt treatment and proper care, most people with DILI can make a full recovery. Final thoughts. Protecting your liver, because you only get one. So how can you protect your precious liver from the wrath of DILI? Here are a few tips to keep in mind. Talk to your doctor. Before starting any new medication, prescription or over-the-counter, discuss it with your doctor, especially if you have any pre-existing liver conditions. Read the label. Always read the medication label carefully and follow the dosage instructions to the letter. Don't mix medications. Avoid taking multiple medications at the same time unless your doctor has approved it. Limit alcohol intake. Alcohol and medications are a dangerous combination, putting extra stress on your liver. Maintain a healthy weight. Obesity can increase your risk of liver disease, so maintaining a healthy weight is essential. Remember, your liver is your friend. Treat it with respect, and it will continue to work hard for you for years to come. And that's our show for tonight. If you enjoyed learning about how to not destroy your liver, give this video a thumbs up and subscribe to our channel for more life-saving, or at least liver-saving, content. Until next time, take care, and we hope to see you again in the next video.